Assalamu alaikum wa rahmatullahi wa barakatuh. I did say we would be talking about erectile dysfunction again in a part 2. Well, we've gone over some things that could cause it. Now, how do you take care of it? What do you need to do? How do you treat it? What are the steps forward? Well, depending on the what. Please note that whatever I'm going to say here now has to do with holistic health care. Traditional medicine. I'm not talking about what they do in the hospitals. That's not what our own way of treating. We treat people, mind, body, and soul using various traditional medicine approaches. Islamic medicine, traditional Chinese medicine, Ayurveda, Unani medicine, traditional African medicine. But we're not into all those tablets that cause you side effects and you take one tablet to cure the side effect or manage the side effect of another tablet, which you're taking another tablet to manage its own side effect. And so, no, we're not into that. We're into holistic health care. And treatment for erectile dysfunction under this type of treatment looks at all the possible factors and how to recover you from them, how to bring your body back to full function as best as it can, depending on the damage or abuse that allopathic drugs have done on your body. Now, so you have erectile dysfunction. Are you diabetic? If yes, then we need to look at recovering you from diabetics. And yes, there is no disease that has been sent or put on this earth by Allah subhanahu wa ta'ala that does not have a cure. You either know the cure or you don't know it. In some parts of the world where you'd say they are first world or so, they would tell you there is no known cure yet. We don't have a cure yet. We don't know a cure yet. Unlike here in our own kind of climes where the doctor will tell you there is no cure. They said there is no cure and he wants to beat you up because you said there is a possible cure. So, yes, you need to be recovered from diabetes because the drugs that you take, one of their side effects is to cause ED. It's to cause effects on the man. It also affects the woman in a different manner, but we're talking of the man. Do you have peptic or duodenal ulcer? Do you take medication for them? When I say medication, I mean, do you take one tablet or the other that is supposedly for that? It does that. Any doctor worth his salt, worth his certificate will tell you, yes, extended use of drugs for hypertension or diabetes and hypertension have these side effects that along the line they affect one thing or the other, one performance or the other, and there's no cure to it as far as they're concerned because the cause is what drugs you're taking, but we don't want to go into that now. It's a topic for another day. So the traditional medicine practitioner, TMP, will have to recover you from these as a first step based on his or her knowledge. Like I always say, pick well, pick fine. There are a number of people around the country that are vast and knowledgeable in traditional medicines. The person would know. You should be able to ask questions so that your mind is at rest, because there's a protocol to it too. Which do you treat first? Where you have a patient that has diabetes and has an ulcer, or has hypertension and diabetes, how do you regulate him to reduce erectile dysfunction while you're trying to relieve him or heal him or recover him from the other ailments? These are protocol techniques or procedures that would be taken. Diet would come into this. Foods you could take or not take, or you should start off or not start off on, or continue on, will be given to you. Then, of course, the other part is the mental part, your state of mind, as in relationship with your spouse, family relationship, your state of mind, as in possible finances or work-related issues where there's so much burden on the mind. the body might be willing, but the mind might not be. And like that, and your general relationship with God Almighty. So, I guess there's going to be a part 3 on this. Inshallah, we will look at a part 3 on this and go into some parts. I do not like discussing what you would take and how you will treat on fora like this, because there are a lot of complications and a lot of things to be taken into consideration. It's not a one size fit all kind of treatment. So follow, share, subscribe, ask questions, and inshallah we will get to be a very healthy and fit set of people, a society that is full of vibrant health and vitality. Wassalam wa salat ala Sayyidina Muhammadin wa ala alihi wa sahbihi wa sallim tasliman kathiran, till we meet again.